Did you know that your skin, nails, and even your breath can provide crucial clues about your kidney health? Kidney disease is a problem I encounter and treat daily. It's more common than you think and often hides right in front of your eyes. In fact, it's estimated that up to 90% of people with chronic kidney disease don't even know they have it. This is a big problem because if we detect kidney disease early, we can often treat the root cause and prevent further damage. In today's video, we'll be analyzing 18 top signs of chronic kidney disease with a doctor. These signs could save your kidneys and your life. The kidneys are two bean-shaped organs located on either side of your lower back, just below your ribs. Most people think of kidneys as filters, and that's true. They filter toxins and eliminate them through urine, but they do much more than that. They help regulate the levels of salt, potassium, and other electrolytes. They balance the acid levels in your blood. They even control hemoglobin levels and help maintain your bone health. So the question is, how do you know if these sophisticated and complex organs are having problems? When the kidneys begin to malfunction, the body doesn't usually experience immediate pain. Instead, it sends subtle signals, often visible on the surface of the body, that you can easily observe in the mirror every day. The first common sign is facial swelling and puffiness around the eyes, especially noticeable in the morning after waking up. This is a consequence of the kidneys no longer effectively filtering and eliminating excess fluid, causing fluid to accumulate in the soft tissues around the eyes and face. Next is swelling of the legs, ankles, and feet. When the kidneys weaken, sodium and water are retained in the body, leading to swelling of the lower body due to gravity. If you notice your shoes becoming tighter, sock marks digging into your skin, and this condition persists for days, it could be a serious warning sign from your kidneys. Now, let's do a quick test. Roll up your pant legs and then gently press your thumb against your lower shin bone for about 5 seconds. Next, check for any depressions. If there are, that's called pitting edema. And the reason this happens is related to foamy urine. When you excrete albumin through urine, your blood albumin levels drop. Albumin plays a crucial role in keeping fluid within blood vessels through osmosis. So, without enough albumin, fluid starts leaking into the tissues, causing swelling. And this free fluid tends to follow gravity, which is why most people notice swelling in their legs and feet. Although it can also accumulate in loose tissues, such as around the eyes. But the problem is this: even though you're swollen, you actually have less fluid circulating in your blood vessels. And your kidneys interpret that as dehydration. Therefore, in an attempt to help your kidneys retain salt and water, which only makes the swelling worse, and it's a vicious cycle. In severe cases, that fluid can even leak into the lungs, causing shortness of breath. But before you panic, there are many causes of swollen legs. A small amount of swelling can even be normal after standing all day. But that will usually improve at night when you lie down. If your leg swelling doesn't improve or becomes more noticeable around the eyes, it could be related to your kidneys and you should get it checked. Dry, persistently itchy skin is also an often overlooked sign. Healthy kidneys help balance minerals and remove waste from the blood. When this function declines, toxins build up that can irritate the skin, causing dryness, flaking, and persistent itching, even when you've used moisturizer. We call this uremia, a milder way of saying having blood in your urine, and the initial symptoms can really affect your sleep. Persistent, generalized itching, often worse at night, can sometimes be the first symptom of kidney disease. Several things can cause this. Urea toxins can build up in the skin and cause irritation, and those toxins can also activate an itch receptor called PAR2, making your nerve endings extremely sensitive. Worse still, they can eventually invade the brain and chronically activate your itch circuit, leaving you constantly itchy. Half-ball nails. Now, look at your nails, especially their color. Seeing two different colors is normal, especially on the thumb. The lighter part at the base of the nail is called the half-ball, meaning little moved, and you can think of it as part of the nail that is still forming. Now, compare that to these fingernails of a patient with chronic kidney disease. They also have two different colors, but don't be fooled. That's not a normal half moon, and the other half of the nail is reddish-brown. These are called hemispherical nails. Not everyone with chronic kidney disease has nails like this. And in fact, we don't know why it happens, but there is a very clear link between those nails and kidney disease: skin calcification. Now, let's turn our attention to phosphate, a mineral that your body regulates tightly and which causes serious problems when its levels start to rise. We primarily get phosphate from food. In fact, most of us get too much phosphate in our diet, but healthy kidneys can easily handle that. However, when the kidneys are damaged, they are no longer able to remove excess phosphate, and therefore phosphate levels in the blood begin to rise. And the reason this is so important is because phosphate will bind with calcium to form calcium phosphate crystals, and depending on where they deposit in the body, they can cause a range of symptoms. When those crystals deposit in the skin, it is called skin calcification. It usually appears as hard, yellowish-white nodules under the skin and is painless. Many people confuse this with aging or sun exposure, but in reality, it could be a sign of a metabolic disorder related to the kidneys. Muscle cramps, clearly. High phosphate levels are a major problem, and part of how your body tries to control that is through a hormone called FGF23. This hormone tells your kidneys to remove phosphate from your urine, and it also tells your intestines not to absorb as much phosphate as calcium, and it does so by preventing the conversion of vitamin D into its active form. Eventually, calcium levels begin to drop, and that can lead to severe muscle cramps, especially at night when you're trying to sleep. While low calcium isn't the only culprit in the early stages of kidney disease, you may also be magnesium deficient, or you may have too much acid in your blood, all of which can lead to muscle cramps. So, if you experience unexplained muscle cramps and you haven't just started a new exercise regimen, you should have your kidney function and electrolyte levels checked. A very characteristic symptom is changes in urine, unusually dark urine, excessive and persistent foam, or conversely, pale urine but frequent urination during the day and night can all reflect kidney filtration problems. And I'm not talking about a few bubbles that disappear in seconds. I'm talking about a really thick, persistent layer of white foam, similar to what you see on the surface of beer. This is a sign that a protein from your blood, called albumin, is leaking into your urine. This is an early sign of kidney damage, nocturia urination at night, okay? Now for a common misconception. I've noticed most people think that if you urinate frequently, your kidneys must be healthy and functioning well. But when it comes to kidneys, quality is more important than quantity. In fact, the first thing affected when the kidneys have problems is the ability to concentrate urine, and this is most noticeable at night. Normally, your kidneys produce concentrated urine at night, partly because you're not eating and drinking, but also due to a hormone called ADH. So, if you are forced to get up to urinate multiple times during the night, what we call nocturiate could be one of the first signs of kidney disease. Restless legs syndrome is an extremely uncomfortable condition that causes an intense urge to move your legs. Symptoms are usually worst when you lie still at night trying to sleep. The leading theory is that when the brain is iron deficient, it can't produce enough dopamine, leading to this irresistible urge. But how does this relate to your kidneys? Urea toxins cause inflammation, leading to the production of hepcidin, a hormone designed to protect the body from bacteria that thrive on iron. The mechanism works as follows. During an infection, hepcidin takes iron from the body and stores it, while preventing further absorption of iron from food. This weakens the bacteria while the immune system directly destroys them. But here's the problem. When kidney function declines and toxins build up, hepcidin levels rise abnormally. Even when your body isn't infected, it suffers from chronic iron deficiency, which is a cause of restless leg syndrome. In short, if you're having trouble sleeping for any reason, you should have your kidney function checked. Unusual breath odor or a metallic taste in the mouth are also often overlooked signs. When urea and waste products accumulate in the blood, they can cause unpleasant breath odor and alter taste, leading to a loss of appetite. Unexplained weight loss or persistent loss of appetite can also be related to kidney problems. Accumulated toxins affect the digestive system, causing nausea, bloating, and a loss of appetite. Over time, this leads to weight loss and weakness. In some people, uncontrolled high blood pressure is an early sign of kidney disease. The kidneys play a crucial role in regulating blood pressure. When the kidneys are damaged, this mechanism is disrupted, causing blood pressure to rise or fluctuate abnormally despite medication. Another sign is persistent dark circles under the eyes that don't improve with adequate rest. This may be related to anemia and poor circulation, commonly seen in people with impaired kidney function. Shortness of breath or chest tightness sometimes occurs when excess fluid builds up in the lungs, especially in more advanced stages of kidney disease. This is a serious sign that needs early attention. Some people notice dry, brittle hair. As kidneys weaken, hormonal imbalances and nutrient deficiencies can affect the hair growth cycle, making hair thinner and weaker. Cold hands and feet, or a constant feeling of coldness, can also be related to anemia due to kidney disease. When the number of red blood cells decreases, the ability to transport oxygen decreases, making the body more susceptible to feeling cold. Finally, decreased concentration and forgetfulness are signs that toxins in the blood are affecting the nervous system. Many people think this is just stress or age, but in some cases, the kidneys are the root cause. It is important to remember that none of these signs automatically confirm you have kidney disease. However, when multiple symptoms appear simultaneously and persist, that's when you should listen to your body and seek appropriate medical attention. Early detection can help slow disease progression, protect kidney function, and improve quality of life. Kidneys don't cry out for help with excruciating pain. They whisper through small, everyday signs. The question is whether we pay enough attention to listen. If you notice yourself or a loved one experiencing one or more of the symptoms mentioned, don't panic, but don't ignore them either. Early checkups, lifestyle adjustments, and proper health monitoring can make a huge difference to your future. If you found this video helpful, please like and share it with your loved ones, especially those over 40 or with a history of diabetes or high blood pressure. And don't forget to subscribe to the channel so you don't miss the next videos, where doctors will help you understand your body, detect diseases early, and proactively protect your health every day. Kidney health isn't something to worry about tomorrow. Start taking care of it today.